Welcome to Healing with Her, the podcast where women in medicine share bold and honest conversations from the front lines of healthcare. Step into the world of Black women medical professionals as they unpack the power of healing, the weight of care, and the beauty of showing up whole.
Hello. Welcome to Healing with Her, the podcast where women in medicine share bold, honest, and healing conversations for the front lines of healthcare. I'm your host, Dr. Melissa Neal, and I'm thrilled that you're here. Whether you're a healthcare professional, someone passionate about wellness, or someone who's looking to gain more knowledge about your own health and well-being, you'll find stories here that resonate, educate, and inspire. This podcast was born from a shared truth. Healing isn't just about medicine. It is about connection, listening, and leadership. And who better to lead these conversations than women physicians? Disclaimer: this information shared on Healing with Her is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified healthcare provider with any questions you may have regarding your health. The views expressed by the host and the guests are their own and do not necessarily reflect those of their institutions or employers. All right, so we're going to introduce the rest of the panelists.
Hi, everyone. I'm Dr. Pamela Reed. I'm an internist.
My name is Dr. Brian Wilson, and I'm a podiatrist.
All right. So, Dr. Wilson, tell us, what is podiatry?
So a podiatrist is a doctor who practices anything that deals with the foot and ankle. We have a DPM, which is a doctor of pediatric medicine, so it's separate schooling from MDs or a DO.
Okay.
So we go to school. For instance, I did 4 years of undergrad in Rochester at RIT, and then I did 4 years of podiatry school at William M. Scholl College of Pediatric Medicine. After that, I did an additional 3 years of residency training. So we do a lot of training. We learn about the whole body, but our last 2 years of school and training mainly focuses on the foot and ankle.
Okay, all
Yes.
right. So when we're thinking about, what type of patients do you see that routinely come into your office?
So one of the biggest populations that we see are people with diabetes, right?
Okay.
So, or what, especially Black people call sugar.
Okay,
Right? So
all right.
a lot of people with diabetes, and the main reason why we see people with diabetes is because those are some of the smaller vessels in the body.
Okay.
Blood vessels, nerves, and so people need to have their feet checked when they have diabetes to decrease the risk of them having an amputation. Just getting their feet checked. When they come into the office, we check circulation, we check their nerves, we check the integrity of their skin, and we check all of it as it relates to just their health and their well-being.
Okay. So if somebody has diabetes, when do you recommend that they should have their feet checked?
So upon being first diagnosed, they should have their feet checked.
Okay.
And they should be checked at least once a year. And then when you go to that visit, then your doctor will assess if you need to be seen more regularly.
Okay.
For some patients who may have what we call peripheral vascular disease or poor circulation, they will need to be checked more often, typically every 3 to 4 months. If they have what's called neuropathy or nerve damage, again, every 3 to 4 months. And typically, they have a combination of both, some nerve damage and some poor circulation, which, again, will put them at greater risk for amputation or some kind of sore. The other time you should see somebody is if you develop a sore or lesion or a puncture wound. Don't wait. Right?
Okay.
Don't think it can get better on its own, especially if you've been cleaning it, properly dressing it, and if it's not better within a few days, don't wait. You should see your podiatrist rather quickly.
Okay.
Are there other chronic conditions, Dr. Wilson, for which people should see a podiatrist regularly?
Yeah, so there are some conditions where people have like systemic autoimmune issues, maybe rheumatoid, maybe neuropathy from other sources, not necessarily diabetes. Sometimes patients who have had chemo will have neuropathy just from the damage that chemo can do. So again, anything that, doesn't allow you to have typical sensation, you would want to be seen and treated sooner. The other reason why definitely people should see a podiatrist is if they have a pain. Foot pain is not normal. Okay. And so a big thing that I also treat are people with heel pain. Okay. And so that's not something that's normal that you should just learn to live with. So people come in for heel pain. That's another big thing that we treat, people with heel pain.
Gotcha. So I know you were using the word neuropathy. I know we know, but like, what is neuropathy, and what are some of the signs and symptoms that people should be looking for?
Okay. Yeah. So neuropathy is basically nerve damage.
Okay.
And it typically happens in people with diabetes who have high blood sugars.
Okay.
When your diabetes is not well controlled, the sugar, your body's inability to, process insulin, things like that, it affects your nerves. So some of the beginning symptoms that patients complain of: numbness, tingling, and or burning to the feet.
Okay.
Mainly to the toes, usually worse at night.
Okay.
Another thing that people complain about, which is kind of funny, is they'll say like the ball of their foot, they say it feels like a bunched up sock. A very, very common presentation that complain about. It feels like a bunched up sock is in their shoe. They check, it's not there.
Okay.
And just a really funny feeling that they have.
Okay.
People with diabetes will typically feel that worse when their blood sugars are higher. So it's important to maintain proper blood sugars, knowing what your numbers are, knowing what a hemoglobin A1C is, right?
Yes.
So sometimes I know we all seen patients and they have diabetes and we're like, what's your hemoglobin A1C? And they're like,
I don't know.
I don't know what that is. Or they'll give you their daily sugar numbers. They'll be like 120. I'm like, well, so that's a number that should be around 7 or below ideally. And so getting patients to even understand that and what that means and how important it is to keep those sugars well controlled. Because what we do in the office is I have patients close their eyes and I check their sensation, like with this little, like a monofilament. It's just a light pressure touch. So we check 10 areas of the foot. And if you can't feel a certain amount of areas, that puts you at greater risk and you lose what's called your protective sensation. Meaning if you step on a piece of glass or a nail, you would not feel it.
Oh, wow. Okay.
And you'd be surprised how many patients come into the office for a 3-month, 4-month up checkup, and I pull a piece of glass out of their foot.
Oh, wow.
Yeah. And they had no idea that it was there. And so thankfully they came in when they did. I saw the piece of glass. But sometimes you get patients who have had these things in their shoe and their foot. Classic example, I kid you, I had a patient who walked the mall, right? She was a mall walker. She liked to walk the mall. And so she got home from walking the mall and she couldn't take her shoe off. She stepped on a nail, it went through her toe, and the nail, so she couldn't get the shoe off because the nail was through the shoe into the toe. And she couldn't get it off.
She couldn't feel
it? She couldn't feel it because she had neuropathy. Now, thankfully, she had enough gumption to go immediately to the ER to get assessed, do the things that she had to get done, and we were able to save the toe and save the foot. But sometimes, what if she didn't go home right away to try to change her shoes, or, what if she just kept going about her day? There's really no telling, how much worse that situation could have turned out. So for people with diabetes, it's really, really, really important, and I can't stress this enough, really, really, really important to just check your feet every day.
Okay.
Take a few seconds, look at your feet, look in between the toes, look at the bottom of your foot. If you can't look at the bottom of your foot, get a mirror. Use the mirror to look at the bottom of your foot, or have somebody else help you to check your feet, because it's really vitally important to be able to just check your feet and just quickly look them over, because things can happen very quickly with a foot the toes are so small. Everything
Right.
is so small. My goal is to get you to keep all 10 piggies that God gave you.
That's right. No, I guess I never knew about that. That's something, for me as an ophthalmologist, I see people with diabetes. That's something I could easily say, hey, you can't get in, you haven't been to the podiatrist. Well, make sure you're checking your feet, just like we come and do the eyes. That's a great little tidbit.
I try.
So, Dr. Wilson, for diabetics, what type of advice do you give them in terms of just generally taking care of their feet?
Okay, so one of my biggest things, shoes. Shoes, okay? And this is not just for people with diabetes, but shoes in general. Number one, if your shoes are over 5 years old, it's probably a good time to get rid of them.
Okay.
Number two, checking the bottom of the shoe, checking the tread of the shoe. If there's no tread, it's like you don't drive around on bald tires.
Right.
So why would you walk around on shoes with no tread on the bottom, right? This is your body. These are your feet. You need to take care of them. The other thing is if you have a shoe that bends too easy, there's not enough support there. There was a craze for a while, with the shoe sock. You know what I mean? The ones that you can bend easy. Yeah, no, those are not great. They don't provide any kind of support, any kind of stabilization. So shoes. Also, you want to make sure, I'm a big fan of, especially with people with diabetes, of a shoe that has a mesh top to it. Something that isn't leather, because that will help prevent any rubbing, any irritation.
Okay.
Again, with people with diabetes, you want to do everything that you can to prevent any kind of open sores, any kind of open lesions. So you want to make sure you wear something that has mesh to the top and not something that's really tight on the top.
So sorry. I don't know how to silence this, but I'll figure it out. So sorry.
No problem.
So, like you're talking about shoes. So, how do you feel about the high heel shoe?
So, I wear high heels. I love high heels.
Okay.
If you can walk in them, great. If you can't walk in them, don't.
Okay.
We've all seen those people who try to walk in a heel and can't.
Okay. So
Right.
you're not opposed to it?
I am not opposed to them. I am of the attitude, if you can, I like to wear a cute heel and then go sit down, right? I'm not in my 20s anymore where I would be in the club all day with my shoes.
Right.
But I could do that when I was younger. Now I want a cute,
Okay.
go sit down and, preserve my feet. I am not against a high heel shoe.
Okay.
But again, if you can wear them, not everybody can. And walk in them properly, great. If you can't.
Yeah,
So
those
what
are
is
my going to dinner shoes.
Yeah.
Okay.
Yeah.
I'm getting out of the car. I'm going into the restaurant. I'm sitting. I'm getting up. I'm going to my car, and I'm
Exactly.
taking them off.
I love that.
So what is walking in them properly mean? What do you mean?
If you can take as normal as you can, so you can't really take a normal heel to toe gait in a high heel, right? But as normal as possible. Some people, I don't know how to say this nicely. They just kind of clog hop in them. They look like
They're okay.
yeah.
Okay.
If you can take a regular step in the shoe as a normal of a gait as you can, I think that is optimal.
Okay.
Okay. I actually did a talk with, I went to RIT, and so I was talking to the young ladies about, proper shoes and things like that. I said, so, if you out at the club, it's probably not a good time to try to be breaking in a new pair of heels.
Okay.
Break them in at home first. If you can walk around, if you can, get low, then you can wear those at the club. But if you can't do that, please don't wear them outside in public.
Gotcha.
Wait until you practice.
All right.
Yes. Heels are not for everyone.
Okay. What about those barefoot shoes?
Nope, not a fan.
You don't.
Not
so
at all.
okay.
Zero.
Okay. So there's no truth in that, God made us to be without shoes.
God did a lot of things, and I just do not ascribe to the whole barefoot shoe thing.
Gotcha.
I think they cause more problems, especially for runners. They cause a lot of heel pain. They cause a lot of shin splints. They cause a lot of issues, and they're not ideal for walking, for running, just for living.
Gotcha. Okay.
So one of the questions that I've always kind of thought about is occupations that put people at increased risk for issues with their feet. Are there any particular occupations that you usually see in terms of?
And that's interesting. One of the occupations that I find has the most difficulty are postal workers, postmen. Because they walk like, I don't even know, 10, 15 miles a day.
Okay.
They're putting a lot of mileage on those feet. And so, it can lend them to heel pain, plantar fasciitis, Achilles tendonitis, like pain in the back of the heel. It can lend them to arthritis, in the big toe joint, especially in the midfoot, and just overall general fatigue for them. And so those patients that I see, I definitely recommend an orthotic. So an orthotic is like a custom support that you can get made that's made specifically for your foot that you could put into your shoe that will help support your foot better. It helps with shock absorption. It just helps with arch support and just the overall general support of your feet, help to prevent them from getting tired. And for some people, like if they have like knee and low back pain, because it puts your body in a proper alignment. So an orthotic is always a good option for people, and not just postal workers, but nurses, doctors, people who are on their feet for long periods of time, who are working on concrete, people who work in construction, who have to wear steel toe, just any kind of job where you are on your feet a great majority of the day and you're not in like carpeted floors or things like that.
I know I had chefs in my practice who are standing for long periods of time and wearing those kitchen clogs. And I would always recommend that they make sure that they also have those pads as part of
like
their work
hairdressers
environment.
Too. Yes, they have to have those pads, because just standing on that concrete floor is just not great for anything.
Okay.
Yeah.
So for people who don't have like a disease, do you recommend, is it like recommended that every so often you should see a podiatrist just to make sure that things are okay, or?
Not necessarily.
Okay.
The only time I would maybe suggest having someone see the podiatrist if you're concerned, sometimes children, and especially if the parent has had issues with their feet, because a lot of problems with feet can be hereditary.
Okay.
Especially like flat feet.
Gotcha.
There are things that we can do now that maybe weren't so accessible earlier on.
Okay.
For kids, an orthotic is a good option, but there are some like surgical procedures that are not as invasive as they used to be, just depending on the patient's foot type, that can help prevent them from having a flat feet as they get older.
Okay.
And so, definitely when I have patients come in and I look at the parent and I'm like, and if the kid is there, I'm like, let me see your feet real quick. Let me just take a look real quick just to see what's going on. But I don't think it's a bad idea to have, if you're concerned about like maybe the way your child is walking or how their feet are looking, depending on their age, obviously, because if they're super young, it's a little too early to tell.
Okay.
But as they're getting older, they're playing sports, they're doing things like that, and you're concerned, it's not a bad idea to have them come in and be checked in just to see, make sure everything is okay. They're wearing the proper shoes, they're wearing the right shoe size, things like that.
Okay. So if somebody is older and has a flatter foot, is there things besides wearing, like you said, the inserts, are there things that you can do? Are there exercises or anything?
So really the best thing for somebody with a flat foot, especially if it's starting to affect maybe their ankles, their knees, or their hips, is a good arch support, is a good shoe.
Okay.
And the way I equate an orthotic, and you'll appreciate it, it's like eyeglasses, right?
Okay.
If you don't wear your glasses, you can't see.
Gotcha.
If you don't wear your orthotics, your feet are not being supported and put in the corrected position that they need to be in. So always having a support is pretty vital to just whatever you're doing. People who are active, people who like to walk, who like to run, or just, play around with their kids or whatever, just keeping a good, proper support at all the time is really helpful.
Okay. And you talked about that people start to have a knee or hip. What are some of those symptoms that they might be experiencing?
Just like low-grade, low back pain, like nothing really crazy, but it's like why my back always hurts after I'm at work.
Okay.
Or like my knees kind of bother me. And I'm not talking about like severe arthritis pain or, but just like mild achiness, because what happens when your feet are not in a proper alignment, it brings your ankles in, it brings your knees out, and it brings your hips in. So it kind of can throw everything off just depending on the level of flat-footedness.
Okay.
Yeah.
Interesting.
So you mentioned orthotics. Is there a difference between orthotics and inserts? Because of course everybody
Yes.
buys inserts.
Okay.
I buy mine in Target. You know. I'm sorry. It's true.
Do better. Yes, there is a big difference between an orthotic and an insert. So an
Okay.
orthotic is something that is custom made.
All right.
There are several ways that you can get a custom made orthotic. In my office, we take a 3D scan of your feet. You know, back in the day, we used to do a plaster cast of your foot. Some people do like a mold where you can step into like a box. You know, I don't think that is as accurate. But like I said, in my office, we do 3D scan of your feet. And so an orthotic is something custom, and it's actually a prescription. There's so many different types of modifications that you can make to an orthotic, just depending on what the patient's pathology is or what's going on with their feet. And so you can make them for dress shoes, you can make them for high heels, you can make them for sneakers, you can make them for cleats, you can make them for children. There's really a variety of ways that you can customize an orthotic for a specific person. Now, an insert is something you would buy in the store. Dr. Scholl's, Good Feet. And then actually in our office, we do sell a pretty decent insert, not a custom orthotic, but when you look for an insert, you want something that's going to support you and not just cushion.
Okay.
Okay.
So most inserts that you buy in the store are very flexible and more cushioned versus supportive. And most of the issues that I treat require support and not cushion. Cushion is needed in some cases, but majority of the time you need support rather than cushion. Yeah.
Look, sounds like I need to come see you to
So
get fitted. I mean,
Obviously.
because I mean, yeah, we have flat feet in our.
Yeah. Yes. I don't know, and I mean, obviously, I don't have any hard data on this, but I find like a lot of African Americans are pretty flat.
Do you know what that made? Just
No idea. It's just anecdotally kind of what I see.
gotcha. Right. No.
So we talked about diabetes. One of the other things that I wanted to ask you about are bunions, and I'm asking on behalf of my child, who is a contemporary ballet dancer, and so has been like on those toes and has bunions from that chronic dancing. So what can you do about bunions prior to surgery? Are there things that help?
So let's just talk about what a bunion is. So I brought my beautiful foot model, right? And so a bunion is basically when your big toe joint, this bone here it kind of goes this way, and then your big toe goes this way, and then you have a big bump on the side. So a bunion is typically on the side of the big toe, though you can also have a bunion on the side of the baby toe as well. And so usually when I have patients come in, you obviously want to exhaust all conservative treatment first. And actually a really good orthotic can help with bunion pain. Okay. So when you have a bunion, you got a bunion. That it's not going to go away, but what we want to do is support it and slow down the progression of it getting worse. Because over time, this little angle can get bigger and bigger and bigger. The bunion can get worse. And I don't know if you've ever seen older people where that second toe kind of crosses over the big toe. It's all because of the bunion.
Gotcha.
Okay. And so an orthotic is definitely, in my opinion, number one line of treatment, along with changes in shoes, right? So, like we were talking about high heels earlier. Some people with a big bunion just can't wear a heel because it presses, there's a nerve that goes alongside here.
Okay.
And so that's a lot of times what makes it hurt. Now, some people can have what looks like a bunion, but what they really have is arthritis in the big toe joint. The main kind of way you can tell, a bunion, you have a bump on the side. Arthritis, you have a bump on the top.
Gotcha.
And so, and you wouldn't be able, when you have arthritis, you're not able really to move that big toe joint as much as you had been able to in the past.
Okay.
But again, for that treatment as well, an orthotic is always the first line of treatment.
Okay.
In my opinion, and I've been practicing 16 years.
Congratulations.
I know, right? I'm like, oh my God, 16 years. Only do surgery if it hurts with every step you take and every single type of shoe you wear. If it doesn't hurt, don't fix it.
Gotcha.
Because people think that bunion surgery is is easy.
Right.
It's not. It's your foot.
Okay.
Right? How do you get around? You walk. How do you get around with a bunion? You don't.
Okay.
You sit down. And lately I've been taking to putting casts on people to just try to really get them to be, more compliant and sitting down.
Oh, wow.
Because it is your foot.
Yeah.
It's your foot. And so you're really a lot more limited than you think you're going to be, especially if you want it to heal properly.
Okay.
So unless it hurts with every step you take and every shoe you wear,
don't do it. So when people have that, like, the little bump on the little toe, does it, is that a bunion, or is that something, where it's like kind of the little toe is falling, it's not perfectly straight?
That's a whole nother animal. That's a hammer toe. That's a hammer toe. That's a whole nother beast all on its own. Yeah. Now,
is it easy to fix those and make your feet look pretty?
So, number one, I don't believe in making your feet look pretty. I believe in making them functional.
Okay. All right.
I do not do pretty feet. I mean, you know what I mean.
I know what
that is not my goal. My goal is to make them functional.
Okay.
Yes. But the hammer toe is a whole nother beast, right? So that can also be fixed.
Okay.
But again, it's a toe, right? And the little toe is the one you're talking about. It's so small. The surgery is, for the most part, pretty simple to do. It takes a long time for that swelling to go away, longer than people say. I usually tell people if they're going to have this kind of surgery and they have a professional where they're on their feet for a long period of time, you're out for 3 months.
Wow.
Because it takes that long for that swelling to go out of the toe and for you to be even comfortable in a
that
shoe
little
again.
pinky toe.
That little pinky toe. Yes. So I'm like, if it don't hurt with every shoe you wear and every step you take,
don't fix it.
we're not fixing it.
Okay.
And if you want it fixed, I will gladly give you somewhere else to go, but I'm not fixing it.
And we don't do it for pretty.
We do not do it for pretty. We do it for function.
Gotcha.
Yes.
Gotcha.
So
Yes.
where do you get orthotics made?
So actually, you can come to my office. We make them in my office. Obviously, it's all an insurance game.
Yeah.
Some insurances cover them, some don't. And so we give you information to check to see if your insurance would cover them or not. But typically podiatry offices make them, and some surgical supply stores make them, but you would have to get a prescription from a podiatrist.
Okay.
Obviously, in my opinion, and I'm biased, it's best to get it from your podiatrist because they know all the accommodations and things to be made that need to be made according to your foot, according to your diagnosis, according to your pathology.
Okay.
So if it's something like, let's say people don't have insurance, but it's something that they want to have, like you said, to protect their feet, what is kind of the roughly?
$400.
$400, okay. And they can fit in different shoes and things like that. Okay.
Correct. And they last 5 years.
Oh,
longer.
That's very reasonable.
Yeah.
Yeah.
Yeah, especially, I mean, it's your feet.
Yeah.
It's your feet.
Yeah, you want to, like you said, you're using them all the time. You're every moment of every day getting around.
And nothing is worse than painful feet.
Amen. I have painful feet and nothing's worse than it.
Yes.
She's my doctor.
So if you had to kind of give advice to keep your feet healthy,
Okay.
what would that be?
Okay, so we're going to start with this, right?
Okay.
I brought this. And I have this up in my office.
Okay.
Big poster.
Okay.
Proper foot washing. You cannot fathom how many people think when you take a shower that the clean water from your body just washes your feet and that they don't have to physically wash their feet.
Okay.
You have to wash your feet.
Okay.
You have to take the cloth. You have to wash between the toes. You have to rinse. And here's the most important thing. You have to dry.
Dry. Yes.
Okay, so people do not dry their feet.
You have to dry your feet and not just like, like you have to take the towel. You got to go in between each toe.
Okay.
So foot hygiene is number one. You have to wash and you have to dry your feet properly. And not to pick on men, but for some reason, dudes just like get out of the shower, throw their socks on. And that's what leads to like athlete's foot. That's what leads to fungal toenails.
Wow.
That's what can lead to warts because they like that moist, warm, dark place like our shoes and socks. So if you're just washing and don't dry your feet, you're just creating the perfect breeding ground for things that you don't want living on your feet. So that's number one. Proper foot.
This I would never have
Proper
thought.
foot washing, please.
Okay.
Yes, that is of utmost importance.
Okay.
All right. Well, I think this has brought us to the end of our wonderful discussion. I learned so much about the foot and how it functions. So I am going to read our disclaimer. So this brings us to the end of our wonderful, insightful discussion about the foot, and our end episode of Healing with Her. We hope you have found the information enlightening and empowering. I know I have. Please subscribe to our podcast on YouTube, follow us, like us on Instagram, and share this with everyone that you know. The information shared on Healing with Her is intended for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified healthcare provider with any questions you may have regarding your health. The views expressed by the host and the guests are their own and do not necessarily reflect those of the institution or their employer. Thank you so much for joining us.